Hi guys, welcome back to my channel. Today I'm going to be talking about soft spot in baby head, and my baby have three soft spot, and that is actually weird because she's supposed to have only two. But before I talk about her own, I am going to explain to you what is a soft spot, otherwise called fontanelle, and when it close. All right, so let's dive right into the video. And remember, if you're new to my channel, please hit that subscribe button, leave me a comment whether it's good, bad, or indifferent. Okay, so these fragile seeming gap on your little one head allow her brain to grow and grow, but they won't stay open forever. If the soft spot on top of your baby head makes you a bit nervous, especially if you notice it's pulsing or occasionally bulking out a bit, you are not alone. But while they may look vulnerable, these soft spots, called fontanelles, have a special purpose. And just like so many other aspects of the newborn phase, they won't hang around forever. Here's what you need to know until they close up completely. What are a fontanelles? Fontanelles are the membrane cover gaps on baby's head where bones have yet to fuse together. When your baby's skeleton start developing, multiple bony plates make up her skull. Over time, these bones will join together into a hard shell completely surrounding her brain. Until then, you will notice the soft spot on the top of the head called the anterior fontanelle. It's not the only one. Babies have another soft spot called the posterior fontanelles towards the back of their head. This gap is smaller and it closes up much earlier. The soft spot on your baby's head may look and feel fragile, very soft. But the good news is that they are well protected thanks to the sturdy membrane covering them. That means it's okay to touch them gently. In fact, you won't be able to avoid coming into contact with your baby soft spot as you go about your routine, whether it's when you're delicately shampooing her hair, or whether you're massage through, or however the case may be, you're gonna come across a soft spot. And that's what happened for me, and how I realized that my baby has three instead of two. Anyway, why do baby have soft spot? Though it may seem as if your baby's soft spot were put there to make you anxious, they actually play an important role. The soft spot give a baby's head the flexibility it needs to squeeze through the narrow birth canal, which is why a newborn can look pointy-headed for a little while after a vaginal birth. That said it, right? After birth, they stay open long enough to accommodate your baby rapidly growing brain. In fact, one way your baby pediatrician will check your baby's growth and development is by gently feeling her soft spot. So now, when do the fontanelles close? Your baby's soft spot won't stick around forever. Eventually, the bones in her skull will build up enough minerals to completely fuse together, and those gaps will close. The smaller back fontanelle typically close by the time a baby is around 3 months, but is sometimes closed at birth. The top one, however, may stay open well into your baby's second year to give that amazing brain the space it needs to grow through by the time your baby turns 1 or 18 months old. It should close up. So from 1 to 18 months, it should close up. So if not, speak to your healthcare provider. Pulsing or bulging soft spot. If you notice your baby fontanelle seems to puff out when she cries, concentrate on a poo or vomit. Do not panic. These can cause extra pressure to enter the body, making the fontanelle bulge out a bit. If the fontanelle goes back to normal when your baby have calmed down and is in an upright position, then all is well. Your baby fontanelle can also appear to pulse whether she is stressed or totally relaxed. Luckily, it is not a cause of concern. The temporary lack of hard covering means you're simply seeing your baby blood pulse along with her heartbeat. You see, nothing to worry about. And you only tend to see what's going on with your baby's soft spot if your baby don't have no hair on her, he or she head. Yes, because once there's hair, you don't know nothing much about what's going on with that soft spot. Ain't it? Anyway, when to worry about baby soft spot. You know I wouldn't leave you without giving you this most important pointer. Normally, a baby soft spot is firm and curves in just slightly. But call your doctor right away if you notice these rare but possible sign of trouble. A dramatically shrunken fontanelle. This can signal dehydration, especially if your baby isn't eating or drinking well and is having fewer wet diapers than usual. A bulging fontanelle with flu-like symptoms. This can sometimes indicate increased pressure in the brain due to head trauma or infection or fluid buildup, especially if your baby has a fever and is usually sleepy. If you notice a bulging fontanelle along with a fever or excessive drowsiness, seek medical attention right away. Next, a fontanelle that doesn't seem to be closing. So 1 year come, nothing happened. 18 months come, nothing happened. Talk with your doctor. If your baby's soft spot haven't started getting smaller by her first birthday, this could point to a thyroid hormone deficiency that need medical treatment. Your baby's soft spot might seem delicate and sometimes even look a little strange, but some occasional bulging and pulsing is a par for the course, and they will eventually go away as he or she gets a little older, which will happen sooner than you think. So, thank you guys so much for listening to what I have to say about the soft spot in your baby head. As I said, my baby have 3, and I do my research. I know she's supposed to only have 1, but she have 3, and as I go along the way and I notice some things, I am not going to keep it to myself, because maybe a mom out there is actually going through the same thing. So after speaking to my healthcare provider, she have indicated me to wait until the baby is 6 weeks to see what happened. If the third one will close, if not, then I'm going to be further step will be taken, and from there I will do another video to let you know what happened after 6 weeks of checkup, if anything changes. But so far the 3 of them are there. Nothing is bulging out or no problem so far. What I do is when I wash her hair, I try to dry it very quickly to make sure that she don't catch up any cold or anything. So I be very overprotective because it's 3 and it's supposed to be 2. So if I'm not alone, please use the comment section down below. Let me know, does your baby have 3 or more like what I'm going through? Did you panic like how I did? And thanks for my healthcare provider who calmed me right back down. Just let us watch it. And like what she do for me, I'm doing for you. Just calm down and watch it. As long as it's not bulging out or shrinking, you know, nothing serious. Let us just pray and give thanks that all is well and stay well for our little ones. Please remember to subscribe to my channel.